the Global Fund for Forgotten People is taking a great pride in being able to bring you information from around the world, and to be able to create a forum where there's feedback and an exchange of information. And today is a special opportunity, as we have been operating principally on Western hours. It hasn't really allowed for us to explore what's going on in the Far East. And YM Park, who is the president of OMK, has kindly made himself available in these wee hours to help give us some background and information on both what's going on in Korea, which I think is a fascinating story, as well as to give an update on OMK and our members and volunteers who are working extremely hard there. A little housekeeping before we begin. I'll tell you that the sessions are recorded, and you're able to find them or share them at the Global Fund website, or by contacting Emily Van Leer. We will, once the meeting begins, we'll be muting your microphones just to have the best experience that we can, but you'll be able to manually unmute them yourselves if you have a question or you'd like to make an intervention. Our usual format is that I begin by introducing our guest, and then we do a short sort of background question and answer. But I really am eager for all of you to engage and to get to meet YM Park. YM and I have been friends for a number of years, really since he was introduced to the order by Matt Lee. Matt is an envoy to the Global Fund for Forgotten People and a member of the Federal Association. However, was tasked by the Grand Chancellor many years ago to help establish a group in Korea. Those of us who have attended the Asia Pacific meetings for the last several years have had the pleasure of knowing him and his team. But with the exception of some of you who were able to meet him in Lourdes last year, I know there hasn't been very much of an opportunity to do so. So I hope that you'll avail yourself of this virtual opportunity to meet each other and for us to just grow our family even further. So with no further ado, I will introduce to you my dear friend, YM Park. So YM, you and I talked a little bit before we got started, and it occurred to me that those listening perhaps wouldn't know the history of OMK. So if you would just give us a little bit of a basis for the history of the group there, I think that would be helpful.
Okay. Well, the Order of Malta Korea was founded in April of 2015. And so, which is relatively a very young organization now. As Lisa briefly explained, we were introduced to the order by Matt Lee, who is a member of Federal Association. You know, as you all know, his root is from Korea. He always has a wish that he can see the Order of Malta is established in Korea, his home nation. And I was picked up by him, and I was suggested by him that I'm interested in helping those efforts. So I said I would try. So that was the start of the order, and we are relatively very young organization. We've been there only 5 years, and number of members are very small. Actually, we have only 11 members now, and since we have very small number of members, and also they are all full-time workers, relatively very young. They are mostly in their early 40s. I'm the oldest guy in the Order of Malta Korea. So because of the small number of members, we have limitations on what we can do. So we have been trying very hard to develop the volunteer organization. And we've been so far successfully put together a 200 people of volunteer group. So the ratio of member to the volunteers is actually 1 to 20. So each member is per 20 volunteers now. That's a very brief history of Order of Malta Korea. We've been to Lourdes for twice, last year and the year before. That was probably the only exposure of us to the European nations and the rest of the members of the world. That's a brief history of Order of Malta Korea.
Thank you very much. I think that will help people understand, particularly when we get into talking about what the response of OMK has been. But before that, if you could give us, much has been made about Korea's early response and the result it had in terms of COVID-19 and how it affected society. I think I explained to those of you who were on the call last week that YM is not only the president of Order of Malta Korea, he's also president of the Chamber of Commerce in Korea, which gives him tremendous access and insight into the thinking of the government and how it functions. So I thought this would be a very interesting opportunity to get to gain some insight. So YM, can you just explain a little bit about how that was, how that went?
Okay, let me just start by talking about how this whole thing developed in Korea. As you know, the COVID-19 was started in China, Wuhan, and Korea was the first country who got infected by the Chinese, and so we were the first nation after the Wuhan of China who has major infections in the nations. We had first patient in 20th of January this year. And then we, just about a month later, we had one big church put together a gathering in the city called Daegu, where they put together about almost close to 6,000 people in one place. That becomes a bomb of pandemic explosion in the city. That was February 18th. So which is pretty early on. That's the start of pandemic in Korea. So which is bad news, but at the same time, it became a rather helping factor for us later, because we had the very early explosion in the very limited geographical area of rural, the outside of capital city. That raised the awareness of the people within the nation, so that afterwards, government took a very preemptive strategy to inspect everybody and trying to contain the infected status. And the citizens has been very cooperative because of that one very isolated local explosion gave a very high awareness and warnings to the rest of the nations. And that was about, the end of February, and that's about the time that we stopped working at the food kitchen. Working at the food kitchen is one of the major activity that our Order of Malta Korea members are doing. We set the rule in such a way that we go out there and do the work by ourselves. So all of the members has been spending at least twice or three times a month in the kitchen. And we put together 6 times a month activities. And that was completely stopped end of the February, not because of us, but because of those kitchen operators. They were concerned about the infection. So all of the soup kitchens and food kitchens and free canteens in Korea has stopped at the end of February. And about a week later, I got a telephone call from priest in that first infected city called Daegu, saying that there are a significant number of kids who cannot feed themselves, because those poor family kids, they can feed themselves at the school because school is providing free lunch to everybody. So we decided to start helping those kids who are not able to feeding themselves. So but as you can imagine, we have only 11 number of members who are very young. So we have limitations of resource mobilization. So I had no choice but to call the chairmen of the major food corporation by myself. I placed, several phone calls to the chairmen, taking advantage of my position as a chairman of Chamber of Commerce. And I called the chairmen and please help us, could you send us some food? So, but I was really happy that I called 3 phone calls to the 3 chairmen. They were very willingly decided to help us, and they sent in about 20,000, meals within 3 days. So that's how we, Order of Malta Korea, started to gathering those foods and put together a relief boxes. And then, while we were putting together those relief boxes of food for those kids, we found out there are even more significant problems which can be potentially applied to everybody in the same group, which is refugees and immigrant workers. We found out that many of the municipal governments and national governments is trying to help those poor people and those people in needs, but those foreigners were just left out of the system. For example, the immigrant workers, and illegal immigrants and refugees. These people are not Korean citizens, and also they are not, legally protected people. So they are completely left out of the system. So we quickly decided to turn our focus from those, poor people of Korea to those foreigners residing in Korea who are not protected by the government subsidy or help. So we put together a food and those also the quarantine equipments like masks and hand sanitizers. We almost put together about 20,000 kits, and all by our own hands. The members gathered together with the volunteers and the warehouse, and we just put it together by ourselves. And we just sending out to all the major cities where those immigrant workers and the refugees are living. So we have been.
When we were with you in Seoul in November, you were speaking about those sort of unseen populations. Are they is that the same group that you were identifying and attempting to serve with respect to the unseen of Seoul that you referred to?
I don't follow. Unseen people by.
You spoke about those that were sleeping homeless and rough in the transit stations, and those that I believe that you said were refugees.
Those are Korean people.
Okay.
When I say refugee, it means a refugee from other countries, from just like Europe. People from Africa, people from East Timor, all over the places. They, hop on the boat and actually came to Korea to get a refugee status. But Korea, the immigration law in our country is very strict. So far, we have about 17,000 applications for refugee status. Only 140 people were approved as a refugee. So which means about 16,000 people are residing in Korea, not as a refugee, but as a temporary residents without any legal protection. So that's one of the big group of people in need. But that was how we started to put together food packages and sanitary equipment packages and spread that to the people in need. The government has been adopting preemptive strategy to inspect everybody. So, which includes people show symptoms and people doesn't have any symptoms. That strategy has worked very effectively. So we have been able to control those increase of the people being infected in the area of less than 200 people a day. So far we have only about less than 20,000 people who got really infected, and about 228 people died. So according to, so our effort is mainly focused in three groups. Those are foreigners who are not protected by the law of Korea. And these people, many of these people are not protected by their own government either. One of the Southeast Asian nations, national people, who asked their own government to send in the plane to evacuate them when we first had a pandemic. The government has rejected that, request. So they're still staying in Korea. So many of those foreigners cannot be protected by the Korean government, cannot be protected by their own government either. So they are completely left out of the system. Second group of people that we are trying to help is the poor people in among Korean nationals, just like people you described, homeless, and also very, very, very extreme poor people who has been depending upon the food kitchen for their meal. And this group of people shows a little different characteristics. We put together a relief box for the foods enough for 2 weeks. So the basic idea was give them the box of food good for 2 weeks. Then we expect that they don't need to come back to the food kitchen asking for food while they're closed. What happened is when we gave them the box, they bring back the box, left it someplace else. They came back the next day. And I said, well, we gave you the box yesterday. And you should be helping yourself for 2 weeks with that. And he said, I know, but I wanted to come, which means they were just afraid of isolation. They want to get connected somehow. So the food is not the only help we can give. So that's why I decided we're starting to figure out the way to open up some of those kitchens, which we did actually 2 weeks ago. We opened up one of the food kitchen and put together a lunch box and just leave it outside the door, and people come and pick that up and go, so that they don't need to congregate in the closed space. Third group that we try to help is actually the medical people, doctors and nurses. They have been working day and night now, for almost 2 months now. So we sent in, for example, some fruit boxes to CDC and also some of the hospitals to help them to, relax for at least 5-10 minutes. That's all we could do for the medical people. But the psychology and the psychological support for the medical people is also very important, because they are often very neglected when people are dying. We just focused on the people who are dying, but the people who trying to prevent them from dying is also having a terrible time. Many of the nurses in Korea has a scar on their forehead because of those quarantine equipment. They have been wearing it for 8 to 10 hours a day for the 2 months, which gives them a scar on their forehead. So 8 out of 10 nurses shows the bandages on their forehead all the time, which is really, really, sad to watch. But so that's one of the effort that we have been doing to help them out. But so far, Korea has been on the reasonably good control now, because the preemptive strategy has worked. So we have been able to control the number of patients who got infected under the capacity of the medical system, so that we don't have any, storm of patients which beyond our medical capacity. So,
how do you see the next few months unfolding now as the kitchen is now able to be reopened, as different parts of society are now reopening? What do you see happening?
Well, the social voluntary distancing has been working quite nicely, and the number of new patients per day has been decreasing slowly. And for example, yesterday we had only 30 new patients for the whole nation. So government is, gaining confidence that they are able to control the outbreak pretty much. So we haven't decided yet. Today, we opened up a school online. All of the middle school, high school, and between 4th and 6th grade of elementary school started their school through online today, nationwide, 3.9 million kids today. And we haven't decided physically when we're gonna open up the school, but our expectation is that that will be sometime toward the end of May or middle of May. When that happens, I think it will be a sign for the rest of the community that reasonable level of congregation we can do. I think that's the timing that we're gonna reopen our food kitchen.
Are you going outside now? Do you wear a mask, or what is the situation for?
I do wear a mask. Whenever I go out of my home, I do wear a mask, especially when I'm in elevator with some other people. But in my office, I don't wear it. The office meeting, we wear the mask. Everybody wears a mask. So we are trying to be very careful. But all of the restaurants are still open, although they have almost no customer. Their business really down to earth. But we did not force the restaurant to close. The subway, bus, and everything is still working. And department store is also open. Supermarket is also open. So we don't really have that, complete closure.
Has that allowed for OMK to begin to function again?
Well, the government doesn't say anything to us whether we reopen the kitchen or not. They don't say anything. It's completely up to us. But we decided to be careful a little bit further.
I see. And what about your volunteers? Have they?
I don't have any problems putting together volunteers. For example, we have been working at one of the kitchen who are open to pack lunch boxes to distribute. We've been working twice so far, and then we didn't have any problem putting together volunteers. The volunteer
Why do you think that's the case? Why do you think volunteers choose to work with Order of Malta Korea?
Because they are confident that they can control themselves, because of the social distancing and the number of new patients has decreased. We believe that we are in relatively safe zone by, putting together volunteer and, trying to wear masks and gloves, and that there will be enough for our protection, because we don't have any confirmed patient among our volunteer group, 0 so far now.
How do you, with respect to the volunteers, you were mentioning, as some other Order of Malta organizations have also experienced, although the food deliveries are vital for the health and nutrition of those we're serving, so much of the benefit comes from just the social contact. I saw a report as recently as yesterday coming from Italy that had much the same message, and I'm sure those the rest of the group on the call who has who have people on the ground helping in this way have also experienced. How do you sort of help the volunteers to understand the ethos of the Order of Malta? How do they how are they able to join into that understanding and spirit?
We putting together volunteer groups through Facebook, social network service. 100%. They are all members of Facebook. We communicate through with them through Facebook. For example, when we reopen the kitchen, we post at our site, volunteer site, and then people apply for their participation. And normally we have to cut the people by setting up the deadline, because we have more members than we necessary most of the time. So we said, thank you, this is it, no more, please come back next time. We do that all the time. So we don't have any problem putting together volunteers. Then because of the volunteers are sharing same, lifestyle through Facebook, people are from very diverse occupations, but they have pretty common, characteristics. They are very active in social network service in a similar age group, still very young. And also they are getting together just for the purpose of serving, not anything else. They don't have any personal agenda to make friends or, to become a leader or anything. They don't have that. Only one single purpose, which is serving people. Because SNS is designed that way. You don't really build a relationship by, personal relation. You build a relationship through the same issue that is shared by the social network service. So we take advantage of that characteristics of Facebook, which has been working effective so far.
And how do you orient those people who have this common interest in service to the charism of the Order of Malta? Is there a process by which you give them an understanding of the Order of Malta?
We've been trying to get them into the volunteer network. We don't force them the Catholic faith. We don't force them anything. They are from all kinds of different religions. About 40% of them have just simply no religion. So, but we just slowly tell them, this is the purpose of this getting together, serving the people. We are from Catholic organization called Order of Malta, and we don't try to doctrinate them, but they are accepting the fact that we try to serve the needed. They want to serve the needed. We are sharing the same purpose, same objective, and they're happy with that.
Really, thank you.
I can identify some potential members.
Question.
Please, Richard.
Yes.
You haven't mentioned the role of testing at all in your talk, which occupies a lot of the press, certainly in Europe and particularly in the UK, where the amount of testing has been pretty lamentable. Could you just talk about the role of testing in the success of containing the coronavirus in Korea?
Role of testing?
Yeah.
Oh, okay.
Whether or not people have antibodies or whether they have the virus.
Okay. At the beginning, we didn't have any problem because we did not know that we have that many number of patients coming all at the same time. So we started with a very easy way. But when that church, 6,000 people gathering, was hit by the coronavirus, we knew that this could explode nationwide. So the government decided to designate 3 pharmaceutical companies to build up the inventory of test kits. So they have been building up the inventory, preemptively, and they have been coming up with a system of testing, and they get the result within 6 hours. So, anybody who get any governmental, branch of CDC do the testing, and they immediately send into that one of those 3 pharmaceutical companies. They have to set up a dedicated lab to do the test done. And they have been 24 hours a day, do nothing but the testing, so that we could dramatically increase the number of tests per day, close to 20,000 tests per day, which has been one of the, very substantial success factor of controlling these coronavirus. If we did not have the capacity of high number of tests per day, we could not control the spread of the virus, because we didn't know who is infected and who are not. And the one incident that, explode the number of tests that we could do per day was actually drive-through tests. When people comes in to get the test, they actually infect the whole room. So each number of tests takes about, can easily go as long as 2 hours. People get in, we do the test to 1 people, and they can vacate the room, disinfect the whole room, ventilate the room until the next patient comes in. This takes about 2 hours. So when you have, let's say, 2-3 rooms in the hospital to the desk, you can do only, let's say how many? Just, dozen people a day, which is impossible to contain everybody. And one of the hospital came up with a brilliant idea of drive-through system. So they put together all the testing people on the ground outside. So the people who thinks they get infected comes in their own car and just open up the window this much. And those people are putting that cotton knob into their nostrils and take the sample and put it in the box and send it to the lab. So there's no human contact between the patients and the inspector. And the patient is contained within his car or her car and drive back to her home. That increased the number of tests per day dramatically to 20,000 per day. And then on the later days, which is about 3 weeks ago, they come up with a even different idea as well. For those people who doesn't have any car, they set up a testing, testing cabin outside of the hospital, which is about, 4 feet wide and about 4 feet deep, which has a, that when you go to the lab, you saw that the globe is extended into the box, like,
Yeah.
That's globe is onto the patient area. The inspector is on this side of the glass. So when the patient comes into the cubicle, they actually put their hands into the globe and open up the cabinet in the cubicle, bring out the cotton knob and, do the testing and put it in a box. So they completely physically separate the patient from the doctors, the testers, and for those people who doesn't have any car. So they just walk in, get the test done, and go home. So that also multiplied the number of tests per day. So that's how we could test everybody, those who have symptoms and those who doesn't have any symptoms. One of the key findings here is that this coronavirus, people who has absolutely no symptoms are about 20% of the people who got infected. So 20% of the people infected just doesn't have any symptoms, nothing, just they don't feel anything. And for the rest of the 80%, also about 20-30% of the 80% has a very light symptoms, just like, cold, getting cold, catching cold. So we divide the group of infected into 4 different categories: no symptom, light, serious, and very serious. So the no symptom patient and light symptom patient are not in the hospital. We put them into, just living center for watch. Like, government actually, they mobilized that training facilities for the government bodies. So they have all the bedrooms. We put the people in there and just watch because they don't have any symptoms, or even if they have the symptom, very light. Only those people who have serious symptoms or very serious symptoms are into the hospital. And even in the hospital, we put our priorities on the elderly people who are vulnerable. And we saw a very high fatality ratio among those people who are over 65 years old. I'm 65 years old, so I'm very careful now. But otherwise, we don't really worry about young people because fatality ratio is very, very low actually. And the symptom is not that severe. Doctors told me that, you know, when people get infected, they develop a pneumonia. And actually the pneumonia out of this coronavirus is not as severe as bacterial pneumonia that we normally get after the serious flu. So this is very strange. The symptom is not that severe, but the spreading is really, really strong. Transmission, very strong transmission, but the fatality and the symptom is very light. This is our findings in Korea. But if you could not control the transmission or the explosion of the infections, the number of people getting infected, if the number goes over the capacity of the medical facilities, then you have high fatality ratio because you cannot treat them early on. And when the symptom gets very severe, and if especially elderly people being left out, then they tend to die. You know, so, but the Korean, our strategy has a, you know, merit and demerit as well. The CDC people are expecting that the herd immunity, group immunity reaches 60%, then this pandemic is over. There are two ways of getting to that 60%. One is actually the vaccine being developed and people get vaccine. The other way is actually people get infected and cured and the aggregate number becomes 60%, then this pandemic is over. The CDC people expect that the vaccine is not going to be available anytime soon. So right now, the only way that we can stop this pandemic is actually herd immunity level reaches 60%. The country like United States or some of the European countries who has massive number of infected and many high fatality ratio, it's sad. But if the curve goes that high, you know, those countries can reach 60% very early. Country like Korea, we have been controlling that new patients under the medical capacity, like 100 people a day or so. We have very low fatality ratio now, but the duration of the pandemic can be way longer than those countries who have explosions because we have been taking longer time to get 60%. That's the expectations of the CDC people. So we have been trying very careful not to have second wave of, you know, pandemic when other countries are over that hurdle and trying to go back to normal life while we are trying to be careful, then we may have a second wave of infection into Korea. So we trying to be very careful about that.
YM, turning to the future, I read something this morning about the success of telemedicine. Is that also, along with what you just cited, the 3.9 million children who've just begun to learn online as of today, is telemedicine being introduced on a more broad scale in Korea?
In Korea, I don't think so. Because those you know, online diagnosis or online treatment by the doctor is prohibited by law. This is pretty much, you know, political issue.
Yes.
And
do you think that will begin to change, you know, as you think about the political system in Korea, particularly with the election that took place 2 days ago and the success of the ruling party?
Current ruling party is not happy with that you know, change of legislature. Actually, the opposition party was proponent for that change of the legislature. So the telemedicine will be, I think that will be very hot topic now. If we do have, change of the law, then it will be still very limited scale. But that's very, limited, and special case of Korea. Otherwise, given what's happening recent, this coronavirus thing, anything, through internet or this type of thing will be applied to every activity of our life. School will be, lecture will be done by this internet, and meeting is gonna be more popular through the screen than actually flying all the way to the United States or flying to Europe. Because people flew there just to get a human interaction, not because it's necessary, but in many cases, just because we were comfortable. Because we were uncomfortable with this type of experience in the past. Now people are learning that this could be very comfortable. Then we don't need to travel. Me, I don't want to fly 13 hours to meet people while I can talk to you, like this. So,
as long as you're willing to get up at 1 in the morning, I guess.
We wanted to put together 50 people to discuss this physically as a nightmare.
Yes.
You need to at least prepare for a year or so.
Mm-hmm.
How many days? 4 days? So this is our new life.
Yeah. Well, thank you so much for all of this, these ideas. I guess my last question just pertains to Order of Malta Korea and what your plans are for the coming year, whether the field of action is changing or what you're thinking about.
Yeah, because of we expect the economy is going to slow down quite a bit, and it has been already, and we anticipate increased number of jobless people. People will be left out of the system for sure, because the economy is slow and the people are being laid off, and unless the economy is going like V-curve, go back up like dramatically, employment is not going to come back that quickly. Then we should be ready to help them, because more people will be jobless, more people will be poor, and so we expect that we may need a more requirement to help those people in need. That's one of the expectations, and so we should be try very hard to address that situation. And but at the same time, this whole thing could give us an opportunity as well, because we try to, well, for example, we didn't really focus ourselves on those illegal immigrants or refugees. This was very new to Order of Malta Korea. We have been trying to serve only people in the slum, not these people who we don't know where they are living together. There has been several areas where refugees are living. We didn't know, I didn't know. So we try to help them. Also, some of those refugee people, I sent down a textbook for Korean language, because they have been living here for several years while they're applying for the refugee status. And they could not speak Korean. They didn't have any citizenship. They don't have any income. They're only living out of the very mere subsidy. So they need to be able to understand at least our language to get some job or anything. So I sent down the textbook for Korean literature to the refugee camp. Things like this, we opened our eyes, and then we see more opportunities to help. And since I'm a chairman of Chamber of Commerce, industry-wise, that one interesting story that I want to introduce to you is that, for example, in the supermarket in New York, at the beginning of this thing, all the shelves are empty. People couldn't buy toilet paper. People couldn't buy, foodstuffs, cans, and, nothing. But the Korean supermarkets are all open, full with the shelf, even if people are not visiting supermarket that many. How can you make our living? We get delivery. Delivery business has exploded. My daily routine is after my dinner, I use this cell phone. I order food stuff for the next day, veggies, cheese and everything. That's delivered on my doorstep 7 o'clock in the morning next day. Then I cook that. So this delivery business, this is really explosion now, because people just don't go to the crowded place, and the delivery comes to you. So people like California, place like California, it may not be easy because geographically you're so dispersed. But a place like Hong Kong or many Asian countries or big cities in Europe where people are just densely living together, delivery business is the future. Yeah.
On that note, I will thank. Do I see someone with their hands up or just? Okay, no, I don't think so. I just want to. Winfred has a question.
Okay.
Wow, very interesting. What can you tell us about your neighbors in the north?
Interesting subject. They have been claiming that they have a 0 patient now, which I don't really believe them. But one thing for sure is they don't have any pandemic explosion either, because they are completely isolated society. There isn't much interaction through the border. And, what makes things better for them is actually they are on the international sanction for the last 2 years. They have a far less interaction at the border than they used to be. So the chance of getting infected is very low. And on top of that, when I was in Pyongyang last year, I didn't see much, cars on the street. People just don't travel around in that country. They are just mostly spending their time in the walking distance or distance where they can ride bicycle. So the transmission speed, by nature of the community is very low. So I do believe they have a very low number of infection. I don't believe 0 though, but I don't think they have the major pandemic explosion either. But fatality ratio, if they get infected, will be very high, because I know what their medical system is like. So if they have that problem, maybe we should be ready to help them, send them some medicines or masks and sanitizers as such.
Thank you very much.
You.
Well, I will draw us to a close and thank everyone for their participation again, but particularly YM, and for all the information and insights. This conversation could have taken a number of directions. It's a really special introduction.